Just turn your volume off, it.
Hey, Sandra. Everyone, and welcome to today's conversation about COVID-19. My name is Denise Crarey, and I'm happy to serve as your moderator this afternoon. We have a distinguished panel of guests with us this afternoon. We have Dr. Milton Brown. Dr. Brown currently serves as the CEO of Trocar Pharmaceuticals in Maryland. Dr. Brown received his medical degree from the University of Virginia and a PhD in organic chemistry from the University of Birmingham. For 20 years, Dr. Brown and his team have worked on developing different medications, and he currently, you'll be very interested to know this, is working on developing a therapy for COVID-19. Welcome, Dr. Brown. We're so happy you're here with us this afternoon. And we have Dr. Crarey, an emergency medicine physician who's worked for many years on the front lines of some of the busiest emergency rooms in our area. Currently, Dr. Crarey serves as the medical director for the occupational medicine for serving our first responders here in Prince George's County. Dr. Crarey, we're so happy to have you with us this afternoon.
Thank you.
Gentlemen, before we begin, and to our listening audience, I'd like to talk about what happened this morning at 7 a.m. The Governor Larry Hogan's executive order went into effect. That order is telling us that any resident in the state of Maryland who goes out in public to any retail facilities must be masked. They must wear some kind of face covering before entering either any kind of store, actually. And so that really does lay the foundation on how serious this particular disease is that we are facing. And so parents, for those of you that are listening, I'm going to ask you to take just a moment and gather your children, your teenagers, your adolescents. This is a very serious discussion that we're going to have, but it's going to be very real. And it's going to happen in such a way that everyone can understand. We know that children sometimes need to have that information filtered, and so parents, that choice will be up to yours. But for our teenagers particularly, some of the teenagers that I've had an opportunity to speak with don't really understand the seriousness of this disease. And so we invite you to bring them with you in on this discussion this afternoon. So let's start with our first question. Dr. Brown, I'm going to ask you if you would help us understand what exactly is the coronavirus?
Denise, thank you. I want to talk to you a little bit about this virus that has infected our community and changed our lives. The coronavirus is a large family of what we call RNA viruses. So this is a type of virus that can change, infect our cells and do things to the cells that cause the cells to act in a different way. It's common in people. Did you know that coronaviruses have been around a long time? The first one was affected, called the SARS virus. It was in 2003. And we had the MERS virus in 2012. And now we have SARS-CoV-2, the second version of the 2003 virus that we experienced. We call that virus COVID-19. There are 103 cases of COVID viruses and sampling them have shown that there are at least 2 versions of COVID-19 that are circulating. For our biblical scholars, just to give you some intrigue, the coronavirus is derived from the Latin word corona, meaning the head, meaning the crown. I don't want this crown, and neither do you. I want to tell you a little bit about this virus. First, I'm going to start with a very important thing for us all to understand. God.
Oh, no.
Well, Dr. Brown was getting ready to tell us something very important that we want to hear. And while we get him back online, Dr. Crarey, there's something I want you to help us understand a little bit. Earlier this week, we learned that the CDC found that 33% of all COVID patients were African Americans. Now, what makes this really interesting is that the African American population is only 13% of all Americans. So what should we derive from that? Is that an indication that African Americans are more susceptible to this disease? Or help us understand a little bit more about that, please.
Well, it's a very good point and a very good question that you're asking. Excuse me. The Centers for Disease Control actually came out with a statement this week to kind of give a little bit of a different spin on this. They said there's really no obvious genetic predisposition for why any group, any ethnic group per se, should be more susceptible to this virus. However, what they did say was that this is probably geographically based. And so what I mean by that is the majority of our case, well, 30% at least of the cases of COVID have come from Chicago, Detroit, New York, big cities. And the concentration of the African Americans in the big cities is larger. Also, in the larger cities, we also have more elderly and more African Americans who do not have good health insurance. So they're not able to get to the doctors, they're not able to get the care that they need. And oftentimes they have these comorbidities that seem to contribute to this disease. So that makes it difficult to fully grasp why all of this is here, except that it seems like it's because it's concentrated in the cities and because we as a people, not just us, but also Hispanics and Native Americans are getting this virus at a much higher rate than whites per capita, is because of the fact that we just don't have access to care. So who are the most susceptible people? Who are those at higher risk? So let's talk about those for just a minute. I'll give you some categories. The first is individuals who are over 65 years old. Why? Because as they've lived longer and we know as you get older, you're more susceptible to have more medical problems. So that's one of the things. Also, they're often confined to nursing homes, which are petri dishes, or these areas seem to just spawn the growth of this disease because they're there, they cannot go away. You have people coming in and out of the nursing homes that are bringing this disease with them, the healthcare workers, if they're coming in there and they don't have symptoms, so nobody knows. So that's why the elderly are particularly singled out when it comes to this. There are underlying medical conditions that also affect this. Asthma is a serious problem. And all these conditions that I'm going to mention, if they're under control, they're less likely to be as contributory to the illness, to help the COVID virus. But if they're controlled, then it makes it harder for the virus to affect the change that it's trying to do in the body. So if you are on medicine, take your medicine. Do whatever your doctor's telling you to do so that you can at least help to fight this thing. So here are some of the diseases. Asthma. African Americans have a higher risk of asthma. So do Native Americans and Hispanics. People with serious heart conditions. Anybody who's immune compromised. And by immune compromised, I mean anything that causes your immune system not to be able to work at its highest level. For instance, somebody who's getting chemotherapy, or somebody who smokes, or has an organ transplant. They're on medicines to reduce the ability of their immune system to work. Severe obesity also is another item that causes issues with individuals. Diabetes, because it also reduces the ability of the body to fight infection. And kidney disease. Is Milton back with us?
No, he's not back with us yet, but I wanted to piggyback on something that you were saying, Dr. Crarey. So you're saying that African Americans, by and large, are not more susceptible. It's some of the issues that, underlying issues that we are more susceptible to that bring about the fact that we geographically, you're saying, more African Americans are found in the cities, and that's why there may be a higher rate of instances in the African American community. Thank you for that. I wanted to move to another topic, if you don't mind, and that is, in recent days, we've been hearing something about contact tracing. What exactly is contact tracing?
Well, contact tracing is a very, very, I think, a dangerous part of this whole process. And the danger is the giving up of our personal rights. And we've lost a lot of those already because of this virus, but this particular one is personal. It begins when a person gets a positive COVID test. If you have that test, you sit down with somebody who then goes over your past history of the last 2 weeks of your life. You must outline everybody who you've come in contact with, how long you spent with them, what time you spent with them. You also must trace your steps to every place you've been in the last 2 weeks. And what happens at that point is your cell phone is now identified as a person who has the disease. You all may not or may know that your cell phone can be tracked anywhere in the world within 3 meters of where you are. That's about 9 feet. So what this does is, if somebody else comes in and they say, we haven't been around anybody, we don't know anybody who had this, that they can now trace where you've been and detect if anybody, because they have this now thing attached to their phone, they can check where they've been, if they've been anywhere near where you were, that you could have come in contact with them and therefore gotten the disease.
So I guess contact tracing could be good in that. I see what you're saying in terms of it being a very dangerous thing that could infringe on our rights, but good in the sense that it does allow then for people to be identified, possibly, who are asymptomatic. Now, what makes a person, say, who is asymptomatic? What makes that person dangerous, even though they haven't exhibited any symptoms? Can you talk to us a little bit about that?
Yes, and this is one of the biggest problems, and that's why they go back 2 weeks to trace where you've been and what you've done. You can have this virus and not even know you have it. And so you may have no symptoms, or you may have very light symptoms, like a light cold or a light upper respiratory tract infection, but still not even know that you have the virus. During the period of time, from the time you get infected with the virus till the time you manifest the disease, could be days. So you could be 5 days, a week, even longer, and walking around thinking that you don't have anything, and all the time shedding the virus onto new people, infecting people that you don't even know. I'll give you an example. My dad is 98 years old next month. One of his caregivers went to New York. When she came back from New York to Florida, I asked her not to see my dad for 14 days because I wasn't sure whether she had been exposed. She didn't think she had been around anybody or anything. The 14 days expired, and the day afterwards, and she was a healthcare worker, she went to work and got tested. Never had any symptoms, never had any issues. She comes up positive. So I can't have her now coming back to take care of my dad. Why? Yes, she may have been exposed in New York or someplace else. She may be one of those people who is a carrier of the virus, which could still continue to spread it even though she's asymptomatic. So this is where the real danger in this is. Getting cavalier and going out without any kind of protection or just going out, period. You have no idea who you're coming in contact with or where they've been or what their status is as far as this virus goes.
You know that one of the areas, Dr. Crarey, that you are an expert in is in disaster preparedness. And so in terms of this particular disease, we've heard a lot about social distancing, which seems to be working in a lot of areas and bringing the numbers down, flattening the curve as they speak. But we've been social distancing, we've been washing our hands, we've been wiping down our food bags. What other kinds of things can we do just in our homes, in our families, to make sure that we're doing what we need to do to protect ourselves? So what kinds of things can we do?
Well, let me give you a couple of things. You all have heard that today, as of 7 o'clock this morning, the governor has said that when you go outside now, or you're going anywhere, or you're going to be in the store, or you're going to be around people where other people could be, you must have on a mask. So we've just had a discussion about these masks, and most of the masks that people are wearing, these homemade masks that we've received, some have those, and some have these surgical masks that they're getting at work. Essentially, in the presence of this virus, they're basically ineffective. The one thing they're good for is stopping droplets. So if you're speaking to someone and that person has a tendency to be very expressive, if droplets come from their mouth and they're infected with this virus, at least the mask would help with that issue. The problem is when you have a mask on, and I'm getting ready to put mine on, when you have a mask on, the question is, what do you do after you're inhaling air? And guess what? We also know now that the coronavirus can stay in the air for 2 hours after an infected person has been there. 2 hours, and you're breathing that. If you're breathing air in and the particles stop or block somewhere along the way on your mask, and you get home, and how do you take that mask off so that you aren't getting those particles on your hands or on you? It's a specific way to do it. I want to demonstrate this to you right now because many of you may not know, and you're going to be wearing a mask at some point in time, whether it's homemade, made with a bandana and hair ties, or whether it's something that you get that's mass produced, unless you get an N95, which is available now. You can get those online, and that's the best mask. That one does block the virus. So when you have your mask on, if you touch the front of the mask to pull it off, that's incorrect because you've just contaminated your hands. The way to remove the mask is by the ear loops. You take one ear loop off and then remove the other ear loop off and then drop it in the washing machine or put it wherever it is that you're going to get these things clean. Very, very important. The second piece is a lot of you are wearing gloves now, but you really don't know how to put on or remove those gloves. Putting them on is not a problem because you don't have anything on your hands at that point. But once you have the gloves on, how do you get them off without contaminating your hands? I'm going to teach you that right now. This is very important. You grasp with one hand the middle of the glove of the other hand and gradually slide it off. Then in your hand where you grab the middle of the other hand, you roll the glove up in the middle. Slide your finger under the edge of the other glove and slide it off so that everything is kept inside the other glove. Then you dispose of that in the trash. Very important, because if you just snatch the gloves off, you're going to have this stuff all over your hands. And next thing you're touching your face, and then you've got a whole nother issue going. It's so easy to expose yourself. So please.
Thank you for that demonstration. I'm sorry. Thank you for that demonstration. I've been to the grocery stores, and what I see now, I see almost as many gloves in the grocery store parking lot as I do shopping carts. They're everywhere. People are taking them off and just putting them down on the ground, which I assume still contains whatever germs or bacteria they may have on it. And it's left out there, so we have to be very, very careful. To our listening audience, I just want you to know that we're working very hard to get Dr. Brown back up with us, but we're going to continue with our discussion. Dr. Crarey, I work in one of the largest in the largest healthcare system in the state of Maryland. And up until recent weeks, family members were allowed to come in, 1 or 2 persons at a time, to see their loved ones. As this disease has increased and the numbers of patients have increased, we are now seeing that patients' families are not allowed to come in, even when that family member is dying. It is a very sad, painful experience to see family members standing outside of the hospital, unable to come in and be with their loved one. Is there any advice that you would give to our listening audience in terms of how they could prepare in the unfortunate event that one of their loved ones has to go to the hospital? Is there anything that we can do to prepare?
Well, I'd like to introduce you, listening audience, to one of the practices that we use in medicine quite often. Now, if any of you have ever had a physical exam, you know there are 2 parts to the physical exam, sometimes 3 parts. They ask you to fill out all these papers before you get into the office. Then you go into the office and the history is asked by the physician themselves. Why do they ask you all those questions after you fill out the papers? Because sometimes you've forgotten to mention something that's very important. So they give you an opportunity to do that during the history. But what is it that we ask for in the history? So I'm going to give you all of the points that we ask for in a history when we're doing a physical exam. Now, these things are all important, and these are the things that you must document, not just for you, but for your children, for any elderly, for your spouse. Everybody needs to have this sheet of paper with all their critical information on it. And what is that critical information, you ask? Well, the first thing is your name. We want to give them your name, your social security number, or birth date. You want to tell what kind of medical insurance they have. You need to give them your address so that they know where you live. Then we ask you about past medical history. We ask you about things that have happened in your past that deal with medical issues. We ask you the medications that you take. Very important to delineate all of them, including supplements. We ask if you're allergic to any medicines. These are the kinds of things, information that we need when you come into the hospital setting or you come into the doctor's office. We ask about family history of medical problems because it's important to note if you've had any issues that go through generations in your family. We ask if you smoke or drink because those things affect how your health, the wellness, the condition of wellness that you're in. We ask about surgeries. We also try to find out who your doctor is, what your doctor's number is as well, so that if we need to reach out to them, we can reach out to them as well. So those are the things that we look for in the history. If each of you has this piece of paper and somebody ends up having to go to the doctor, They now have the basic information that we need prior to them even arrive, prior to anybody having to hold a long conversation or try to find out all these things up front. So it behooves you to have this ready, to have it available so that you can present it to your physician when you get to the hospital. Anybody in your family that has it, once you get to the hospital, can present it to them.
Thank you. That is really important information because we know that the doctors and the nurses are working very hard when that patient gets there to care for them. And maybe that family member isn't available to answer the questions. And so, Dr. Crarey, I understand that you have formatted something that can be available to our audience with all that information that they can send with that patient if they have to go to the hospital. How will our audience get that from you? Would you be willing to share your email address?
Sure. My email address is sdadoc@msn.com. Again, sdadoc@msn.com. If you reach out to me, I will definitely send you a copy of a list of these items that you need to have for each member of your family. Very, very, very important for every child and for every adult.
Thank you so much. We really appreciate that. I see Dr. Brown has joined us again. Welcome back, Dr. Brown. Are you there? While we continue to work on that document. Dr. Crarey, as you were doing the demonstration, I got word that everyone was not able to pick up the actual demonstration. I believe it was for the gloves. So while Dr. Brown gets back online with us, would you demonstrate one more time the proper way to take gloves off once we've left the building?
Okay. I'm going to slip them back on first, which you should never do because they're contaminated.
Not the same pair.
Yes, this is just for the purpose of demonstration at this time. So give me just a moment. I'll get them right and then we can do it. Okay. Now, can you all see my hands? I hope you can.
If actually, Dr. Crarey, if you could move your hands a little to the left, I believe. I'm sorry, the right. There. I'm sorry, the right. There you are. Thank you. There you are.
See my hands now? Okay, since I'm right-handed, I'm going to use my right hand to be the primary hand. But if you're left-handed, it's just the reverse, the actual reverse of what I'm going to do. When you have the gloves on and you've been touching the handles and the bags and all the things that you touch outside, and you finally leave the store, you have your bags in the car, and now you're getting ready to get in the car, this is the time to remove your gloves. But it is critical that you do it the proper way. How do you do that? Take your dominant hand, whichever one that is, and grasp the opposite hand, the non-dominant hand glove, in the center of the glove. Continue to slide it off your hand so that nothing on the outside of that glove touches this hand. You then take your dominant hand and wrap that glove up in a fist in the middle of it.
Could you move your hand over a little bit, Doctor?
Is that okay now?
Thank you.
Okay. Then you slide your finger under the glove on the dominant hand and gradually move it over as you invert the glove, okay? And therefore now the outside of the glove is now the inside, so it's safe to grab it. Then throw it in the trash, not the parking lot, okay? Put it in the trash. It's covered with virus now, so you don't want to be using that, okay?
Thank you so much. We appreciate that demonstration. Dr. Brown, have you rejoined us?
Yes, I've rejoined you.
Yay.
Thank you. Thank you. I love modern technology, but sometimes it can be a challenge. We welcome you back. Thank you so much. Dr. Brown, when we were talking last, we were talking about exactly what is the coronavirus, and the follow-up question to that is, how does this virus infect one?
Well, I'm glad you asked this question. Before the computer took over our presentation, I was at the point where we talked about what is the coronavirus, COVID-19. And the first thing I want to start with is that God did create this virus, but he did not create it to act like this. And Colossians tells us that for by him all things were created, both in the heavens and the earth, visible and invisible. And so even though God created this coronavirus, he did not create it to act like this, and he didn't create it to be disobedient. This virus has mutated for evil. Now, how does it infect us? The virus has a spike protein that sticks out, and if you were to ball your fist up and stick your finger out, that pointed finger is a spike protein, and it sticks into your cell. But what's incredible about this virus is that once it gets inside of your cell, it begins to turn off all the life-saving and life-supporting mechanisms of your cell. And so your cell now cannot defend itself. And from within the cell, this virus begins to operate and mediate the bad effects that it has.
And so for our young people that are listening, what is the one thing, Dr. Brown, that you want them to understand about this disease?
I want them to understand that Uncle Milton wants to tell you that this is a deadly disease. It's a disease that infects. We thought it infected just our lungs, but we now know it infects our stomach, our heart, our liver, and maybe even our kidney. So what we thought this virus first just was a virus of the respiratory, of the lungs, this virus is a virus of many organs, and it causes an incredible inflammation that attacks your lungs, your stomach, and your heart. I want to tell young people that as we begin to come out of this virus in regards to people letting the standards down on social distancing, that we don't have a cure, we don't have a drug to treat it, we don't have a vaccine. And the virus, even though we say it's time to let down the standards, the virus still exists out there and you can be infected. So because adults say it's time that we're gonna stop social distancing, that doesn't protect us. And it only means that we will be subjected to this virus.
We understand that next week, I believe it is, Texas is opening up, one of the largest states in the country. And we understand Ohio is opening up. True, people are ready to get back to their normal routine, but is getting back to our normal routine, and you know, maybe this is not necessarily a medical question for either of you, but as we begin to get back to our new normal, what is the one thing, and this question goes to both of you, what is the one thing that people should do in preparation? In your opinion, what is the one thing that you would offer them?
Well, I would say that there's a group of things. I can't say just one thing. I know one important thing is that people must stay informed. You must stay informed about what is happening, what is changing. And you try to be understanding. And some of the information that's out there right now is so confusing. We're flattening the curve, but the death rates are going up. How can that even match? That doesn't even go together. Yet the reality is, Flattening the curve is talking about the number of individuals who may be infected or have been diagnosed with the disease. But all those people who were diagnosed before the curve flattened are still dying. Period. So many of them are still dying. So even though the curve may seem like it's flattening, it doesn't mean that there are going to be less deaths. Sometimes there will still be more way past the flattening of the curve. So don't believe that because they say the curve is flattening, that it's okay to go ahead. The other thing is to stay at home. Folks, please stay at home. They have asked you not to go out. Don't go out. I have to go out because I'm a healthcare worker. My wife has to go out every day as a healthcare worker. But if you don't have to go out, stay at home. Many of you are working from home. That's a blessing. The biggest thing in doing that is to make sure that folk aren't coming into your home who you don't know, who you aren't familiar with, who are not a part of your family, who are being vigilant. The third thing is be vigilant. Here's the tendency. It's the number one story in the news every night, and then it kind of moves to number two. Then you start, I don't really need this mask. It really doesn't matter. What am I wearing these gloves for? What am I doing all this for? Folks, this is just as much alive day one when we first realized it, as in fact, it's even more alive now because there are more people infected with this. So you got to stay vigilant. You got to stay the course with this until there's treatment, or until there's a cure or something comes up that mitigates this disease. That has not happened. And I don't expect it to happen anytime soon. So it is important to stay vigilant. And then this one kind of sounds crazy. Stay away from sick people. If you are in the store and somebody's coughing, leave the store. If you're anywhere and somebody's coughing or seems sick, you can't be around those folks. Because unless you have an N95 mask and proper coverings and all the things that you need, and you're sure that none of the droplets from the person can get on you, you're going to be susceptible to getting this virus. And these are just basic things. They sound kind of hokey, but they work. Social distancing is working. It works.
So what I hear you saying is we cannot become compliant. We can't become complacent.
Yes.
We cannot become complacent with this because it seems like the longer it goes and things aren't happening that, we can ease up. Thank you for that, Dr. Crarey. Dr. Brown, what about you?
Yes, I want to say that you can be reinfected as well.
Yes.
So you can have had the virus and become negative for the virus and then become positive again for the virus. So just because you've been infected doesn't mean that you will not get infected again. I want to hallmark the thing that Dr. Crarey said about the mask. The only mask that really protects you are N95 masks, and common folk don't have those kind of masks. We have grandmama's mask, and we have the blue hospital mask. They don't really protect you, but we have to have something on, and that's the best we can do. We have to wear those as now required by the governor's orders this morning. I want to say this next part. The government will issue a plan for reopening in May. In fact, the plan was revealed on Thursday about the 3 phases for reopening. The government will reopen without a vaccine and without a drug. The virus will continue to be infecting people. It is not going away until we allow it to take its course and it goes from our society. So even though we will have some reopening things said by the government, I want our young people to not just run back out there and say, okay, the government said we can open. And I don't want our church members to do that either. I want to tell you this one thing. We do not want any members to die because of this disease.
Mm-hmm.
We don't want to lose not one of our church members. I know for our young people, this is hard. I know this is boring to stay at home. I know this is really cramping your style. But right now, please do not expose yourself to this disease. This disease is a very deadly disease.
Thank you, Dr. Brown. That's very important information, and I hope our young people are listening. I hope they're paying attention. We're going to take some questions from our audience right now, and Dr. Brown, I'm going to give this one to you. This is from Gail Turnage, and the question is it true that it's contradicted to use ibuprofen and elderberry with this virus? We've heard that from several people, and that's one of the text messages that's going around a lot about don't use ibuprofen and different kinds of drugs because they have found that people that contracted the virus did have that. Can you speak to that, please?
I sure can. We want you to use Tylenol. We don't want you to use ibuprofen, that's Motrin, and Advil brands. We want you to use acetaminophen, which is Tylenol. For some reason with this virus, ibuprofen, steroids, and other types of anti-inflammatories of that class aggravate this virus. It riles this virus up. It gets this virus a little more angry. So in the phase where you have your fever, we'd like you to take Tylenol.
All right. Thank you. Dr. Crarey, can this listener, No Let Leader Hutton says, please stress the importance of listening to the medical professionals versus the politicians. Would you like to speak to that? It's a lot of discussions we've had in this house.
Certainly. This is a situation where science trumps politics. I didn't say that as a pun, but it's very important to pay attention to what the scientists are saying. And the reason is because if you listen carefully, you'll find out that many of them really don't have a good grip on this. We still do not know so many things that we need to know about this. But with the knowledge they have, with the knowledge they've gleaned from how other countries have managed this, and with the information that they've learned, they share with us the best knowledge that is available to us. Please do not let politics determine your health care. You must listen to what these people are telling you because they're the ones with the largest pool of information relative to the virus. We don't, even the best that we can do, we do not know everything about it yet. So many things about it. We know it's airborne, but we have never documented a case of airborne infection, of somebody getting it from it being in the air. Yet we don't know if anybody has. There's so many things, and that's just one aspect. So please don't let political information affect your decision. Use wisdom and listen to the scientists.
I'm excited to tell you that also our church has a reentry committee, and you'll be hearing recommendations through our pastors about our reentry back into our church, because the way we worshiped before this virus and the way we interacted before this virus will be different now that we'll begin to reenter. We have this one thing in mind. We don't want one person from our church to be infected with this virus. And we do not want anyone from our church to be infected when we implement a reentry program. We'll make that promise to you, and we will make recommendations that may go far and beyond what the government has recommended to keep you safe.
Thank you. And this question is for either of you. Can you explain, DeAndre Anderson Jackson is asking, can you explain what herd immunity is? Dr. Brown, we'll go to you.
Yeah, I'm familiar with that term of herd immunity, and that is that there are individuals who get the virus, and you get the antibodies for that virus. You get infected, you get antibodies for that virus, and you believe that those antibodies can protect you from other types from an infection, and that the whole infection for the herd, some will get it, some will survive. That's a theory that's out in the literature right now, and we have to be cautious of that.
In addition to what Dr. Brown has said, I want to add to that herd immunity is the premise by which the nation has required vaccination before you can come to school.
That's right.
The whole purpose of that is if you treat people preventing a disease from happening, then the population as a whole won't propagate the disease. They won't keep spreading it on and on because everybody's been treated for it. It's a concept that can work and has worked in the fact that some diseases like polio, for instance, has been virtually eradicated off the face of the earth because we have vaccinations that prevent people from getting that disease. And that's what herd immunity is. By vaccinating everyone or forcing everyone, and that's what the government has done to this point, forcing you to do this or you can't even come to school, they have, though, been effective in eliminating certain diseases or at least reducing them significantly because of the vaccination programs. And that's the herd preventing everybody else, the individuals, from getting the diseases. And that's kind of a part of the concept.
And that's what we talked about before, is that with no vaccine, and we decide to allow people back to socializing and becoming at risk of infection, we're going to see what we call a second wave from this viral infection, because at the moment we have no vaccine for the herd, and we have no ability to protect those who have not been infected. And so once we remove the social distancing, those who have not been infected that come in contact again with this disease will be infected. And we will receive a second wave as what will start in China and other places that have begun to relax the standards.
We're going to take one more question from the audience, and then Dr. Brown, I'm going to ask if you would talk to us a little bit about some of your work that you're doing. But Ruth Taylor is asking, is black seed oil helpful in building the immune system against the disease?
I'll start off, and then Pat, you chime in on this.
Okay.
Anything that can affect your immune system to cause you to respond to this virus is helpful. Unfortunately, this virus is a different type of virus. It comes into the house, it turns off the fire extinguisher, it turns off the sprinkler system, and it creates a fire in the house. A fire that, unfortunately, most people have a problem with being able to put that fire out. Then the virus goes to the next room, and it unleashes kerosene, which is kind of an inflammatory effect that goes to the other organs. The lung then goes to the gut, then the heart, then the liver. And so some of the natural remedies that we have are meant to boost our current immune system. But this virus has a way of turning off those innate mechanisms that our body has so that it can survive. This is a virus that, I'll give you an example. This virus comes in and it turns off the protein that helped it get inside of your cell so that no other viruses can get into that cell but that one virus. This is a very, very deadly virus. And the home remedies that we use, although important for good health, may not be enough to help us boost our systems. There are clinical trials for using vitamin D. I saw a clinical trial. There are actually 11 trials that I've looked at, but there's a trial for vitamin D going on right now to try to be a immune booster. Of course, people have used vitamin C. The problem is that those types of therapies are hard to get inside of the cell. And that's where the virus is doing its work. It's not just infecting the cell, it's turning off the processes by which the body can actually defend itself.
Thank you. We're going to do some really rapid fire questions because I really do want us to get to the work that you are currently working on to combat this virus. So I'm just going to throw these out very rapid fire if you would give us a very quick answer. Judy Pollock, Dr. Crarey, is saying, should masks be worn while doing outside activities such as walking or jogging or doing yard work? This is different than the governor's order about wearing it in retail facilities. She's talking about just actually being outside doing daily activities.
I don't believe that you need to wear a mask if you're not around other people. If you're by yourself, if you're walking, or if you're doing an activity on your own, you do not have to wear a mask at that time. So no, you would not have to wear it if you're gardening or doing something in the yard.
Thank you very much. Dr. Brown, Karen Lee asked, what pre-entry back to church guidelines do you suggest? Very quickly, I know that we're going to be hearing more about that later. So very quickly, are there any things that you want to share about that?
Yes, we're developing a strategy to provide to the pastors for reentry into our church. Brinklow is a church, we love each other. We love to hug, we love to kiss, we love to shake hands, we love to give five. We may have to change our behaviors. In regards to how close we sit, our church is usually full to the brim. But in these new times, we may have to resort to other measures, including potentially multiple worship services that will help us to practice social distancing in our church. The recommendations are being developed. We haven't fully developed them yet, and I'm just proud of our church and our pastors for taking the initiative to begin to look at how we re-enter. Well before this topic came up, we had put together a team to begin to identify the important parts that will require us to re-enter. It may result in us wearing masks. We will have to use sanitation stations, and there will be other types of things that we have to do in order to make it safe. We're going to make this one rule. We don't want one member to become sick because we had reentry. That is our rule.
Thank you. Thank you. And a good one it is. Last rapid fire before we go to Dr. Brown. Dr. Crarey, is there a fee for the test, and can anyone get the test?
Test is free. You cannot get the test unless you have a doctor's referral. So if you're sick or you feel that you're sick or you're starting to get sick, you need to call your physician, who will give you a referral that you can take to multiple testing centers. In fact, some of the places that do your emissions testing have opened up as testing centers. We still are far behind in the amount of testing that we're doing in this country to have a grasp on where we are with this disease. But tests are available. You can get them. They're becoming more available, but you have to have a doctor's order to get it.
All right. Thank you. Dr. Brown, were you going to say something?
Yeah, I had one thing to say. I know that there's an issue that people are starting to see where we see about 30% of the patients have a loss of their taste. and their smell. And people want to know, will I get it back? Unfortunately, for right now, the reports that this will take a long time for it to come back. And that's just a process of this deadly virus attacking the cells of your gastrointestinal tract. But I wanted to put that out there because I know there was a question about the loss of taste and smell.
It seems like every day we're hearing more and more about symptoms that are coming up. Initially, it was sneezing, coughing, sore throat, shortness of breath. Then it moved to gastrointestinal issues like vomiting and diarrhea. And now we're hearing about taste. And this seems to be an ever-changing, ever-evolving disease that we're learning about. And so in our last few minutes, Dr. Brown, at the top of the hour during your introduction, I mentioned that you were working on a therapy to combat COVID-19. Would you talk a little bit about that for us? Yes,
it's a combination of two drugs that we found. There are about 5,000 people in Italy that were put on one of them. And there are another 2,000 recently put on a cousin to that drug. But we found a cocktail of drugs that allow us to fight the downstream effects of the virus. All the therapies that are being worked on right now are viruses, are therapies for attacking the virus. And that means the vaccine attacks the virus. Antivirals attack the virus. We also have blood plasma that you were taking from people who have already been infected and putting in others to see if we can stop the virus. That is antibodies attacking the virus. We're working on different strategies where we're working for the body to stop the downstream effects of this virus, which causes a surge in cytokines, which causes a surge in pathways that cause tissue destruction. Once the virus gets in, we can kill the virus, but it's already started this cascade of really nasty events that causes cell death and tissue destruction in the lungs, in the gastrointestinal system, and in the heart. And so we're working on a drug strategy that actually works downstream of the virus and protects the tissues and the cells from the untoward effects that the virus unleashes. That I hope I said that in a way that was easy to understand.
Thank you. Yes, I believe you did. And so as we begin to close out this time together, the information you all have shared has been so important, so important. And it's going to elicit more questions, as you can understand. We have so many questions from our online viewers that we're not able to get to all of them. But here's one question that's really important. And I'd like for both of you all to answer this. This question comes from Lakeisha Dickerson. And the question is, without a vaccine, how is this thing going to even come to some kind of conclusion?
Very good question. Very good question, Keisha. And we don't know the answer to that. Sometimes these vaccines, which have mutated, will mutate again. And this time they won't be as effective, or they may be even more effective. We can't say. That is a very good question. But one of the things that has to happen is the reduction in people getting infected. And the way we found that's most effective right now is to stay away, is to stay at home, to stay away from other people, because we don't know who has this and who doesn't.
We're in this virus. I want everyone to know, Keisha, you asked a good question about the vaccine. Everyone is trying to make a vaccine towards this spike protein that I told you about, the way the virus sticks this protein into your cell and allows it to invade. Unfortunately, the virus is really, really smart, and it can change the structure of that spike protein so the cell can't recognize it a second time. And so that, because that the virus is able to mutate that entry spike protein, developing a vaccine is really tough. And unless we have a vaccine or a treatment, unfortunately, we're left to the virus mutating itself into a lesser virulent form, or as Pat said, it could be a more virulent form as it mutates. They're coronaviruses that we didn't develop vaccines for. MERS is one, also SARS as well. And they eventually left our communities. This virus is a little different. And as Pat said before, and I want to highlight, please do not allow rules made by the government or our economy to allow you to make decisions about putting yourself in jeopardy of a virus that's still active and still deadly.
Thank you. Thank you, gentlemen. Thank you for spending your afternoon with us. To our listening audience, thank you for being with us. We hope that the information that you gained today will be one piece of it that you will be able to take with you and keep yourself and your family safe. We are living in unprecedented times. It's incumbent upon us to use common sense and to use that common sense wisely. Hug your family, hug your spouse, tell somebody you love them, stay safe, stay home. Until the next time, thank you for joining us. I'm Denise Crarey. Thank you to our panelists. Good afternoon.